Hi everyone. I wanted to come to you today and talk to you about the power of no. I've worked in healthcare for 27 years. I was an LPN at first and then became an RN. And the interesting thing about when you first become a nurse is that sometimes you're very timid and you kind of, are scared to approach physicians. And I learned a long time ago that it is better to approach the physician and talk to the physician because you're a collaborating part of their team. Sometimes we feel like that we're not as smart as the physician is, and that's really not true. We play a different role in healthcare than the physicians do. We're just as important to the team process as they are. And I remember when I first became a nurse, and a physician was at the desk, and I was down the hall, and I had a patient who complained of chest pain. And I wanted to catch the physician before he left. Now, I didn't work where I work now. I wanted to catch the physician before he left. And so I walked up and told him that the patient had chest pain. Now, he berated me. He asked me, did I have a set of vital signs on the patient? He didn't give me a time enough to let him know that no, I did not get a set of vital signs initially because she just told me she had chest pain. I knew you were walking off the floor, so I wanted to go ahead and let you know so that you could go ahead and assess the patient or address the patient prior to you leaving. Now, of course, he left after he got all upset with me. And then after he left, I took a set of vital signs, and then I asked for EKG, which is what she needed in order to determine whether she was having a cardiac event. And so now I, know that, and now I know that, it wasn't just about the vital signs, it was about the full assessment of the patient. But he was just really, really ugly, and I remember that time, without a shadow of a doubt. But I also remember a time at this particular hospital also that I had this physician. It was a family nurse practitioner, and we were working in an area, and she had ordered this medication on this child. And the medication to me seemed like it was a fairly new drug at the time. It's an older drug now. I've been a nurse for a minute, but it was a fairly new drug at the time. And I thought, that seems like a lot for that child. And so I went over and I asked my charge nurse, I was like, well, do you think that's too much? And she said, well, yeah, it seems like it's a lot for that child. And I said, well, okay. I said, well, let me just go to, let me kind of figure it out. And so I went to the lead physician on at that time, and I asked him, I said, does that sound like a lot for that baby? And he said yes, and he said that she should be getting ever so many milligrams per kilogram because, whenever they're children, you have to weigh them, and then you have to give them the medication doses based on their weight. And so I said, well, okay. So I calculated the weight and calculated the medication dosage, and it was too much. I looked it up. Also verified that everything was right before I went back to the FNP. And FNPs are phenomenal. Physicians are phenomenal. Let's be clear on this. But we all, need somebody in our space to, help make those decision-making processes that we need to in healthcare. And so I went back to the FNP, and I talked to her, and she was she didn't like the fact that I went to the lead physician, but I'd asked her prior to going to the lead physician whether she would thought it was too much, and she told me that it was okay to give it. And I told her, I said, well, I just wanted to make sure because I didn't want to overdose the kid, and it actually ended up being 2 times the dosage for the kid. And I just want to give the novice nurse, and even the nurse who's been a nurse for a long time, I want to give you the confidence to, check out your sources. Make sure that that this is the right dosage for this particular patient. Make sure that that, the treatment modality so that you're able to make the decision as to whether that patient should have this treatment modality or whether they shouldn't, so that you can collaborate as a team, make sure. And there was another instance where there was a physician who ordered a pregnancy category D drug, and the drug, the young female, she had just found out that she was pregnant, and he ordered the drug, and he said he still wanted to give the drug. And I said, well, I don't feel comfortable giving that drug, aka I am not giving it. Okay. And so it just depends on your comfort level. And you don't have to be ugly about it, because we're all a team. We're a team trying to take care of our patients, making sure that they're taken care of in an efficient and effective manner. And that's what we all want to do. And so that's kind of the premise behind VP nursing and the nurse nurturer, because we want to make sure that our patients are taken care of efficiently and effectively. Our patients are amazing, and our teams are amazing, and we want to make sure that we hold each other accountable for the things that we do. We want to make sure that we as nurses come to the bedside, or we as healthcare providers, all of us come to the bedside fully aware and fully accountable for what we're doing while we're there, mindful in the moment. And that's what VP nursing is about. It's about making sure that you have the tools in life to take care of you, so that you can then take care of the patient. Because if you don't take care of you, the patient cannot be taken care of. And so I just wanted to come to you tonight and to share that bit of information with you. Again, we're having a conference August 7th, 2020, Brilliant and Balanced Nurses. It's not just for nurses, it's for social workers, medical personnel, for respiratory therapists. You earn 6.5 CEUs. This is not just this is not a monologue. This is a dialogue. I want you to share some experiences with me that you have, that you've experienced with physicians, or that you've experienced even with other nurses, where you've had to come together, collaborate as a team, and make sure that your patients are taken care of efficiently and effectively. So comment in below and tell me how you have, what you have done in the past in order to make sure the patients are taken care of. You're an amazing set of people, because I've worked with you for a long time, and I'm super, super thankful. And thank you, Miss Janet Joyner. She was talking about my wallpaper, and I love my wallpaper. I'm in my daughter's room, and we are this is the best place in order to be able to film. Y'all have a great night. Thank you.